Sometimes the ducts are closed, it's draining for a year, and the ophthalmologist says, I have to do something more than just teach him massage. What would you do to say, cure this or control it?
Well, about 80 to 85% of the children with nasolacrimal duct obstruction, it'll go away with just the medical treatment that we discussed before. But there's a percentage of those kids, obviously, that don't respond to just medical treatment. These children usually need something called a nasolacrimal duct probing. It's done under usually general anesthesia. Some pediatric ophthalmologists elect to do it at an early time in the office, anywhere from 3 to 5 months of age. But a good percentage of us wait until the child is near a year of age if it hasn't resolved with medical treatment. At that point, they're brought into a hospital, they're given just very quick general anesthesia, and a small little wire, which is called a Bowman probe, is passed through the puncta and down into the nasolacrimal sac, and it's basically like a rotor-rooter job. We just go pop, and it pops open the obstruction. Then that allows the tears to flow down through the nasolacrimal duct into the back of the nose, down the throat. We usually inject dye, and when we retrieve the dye from the child's nasopharynx, nose, we know that the actual passageway is patent and open. Those children usually do very well, and about 80 to 90% of them don't require any further treatment. If the child has a problem, we then can go in later on with a balloon catheterization to expand the actual passages, or we can do something called nasolacrimal duct silicone tubes, which stay in the child's eyes for a few months to keep the passage open. If a child has a really severe case, they might need a more serious surgery called a dacryocystoRhinostomy, where a new passage is actually created surgically.